Core TV News presents a platform with presence in over 30 states of the Federation. Be sure to be had. For live coverage of events, we have the capacity to deliver from anywhere in Nigeria and beyond. Contact us now on 0803-471-8550 or 0803-724-9733, 014-533-407.
Our 24-hour news station.
Hello and welcome to Health Issues, the program that takes an in-depth look at health challenges faced by humans in our society. I am Anita Fatunji. Today we shall be looking at obstetric fistula. Obstetric fistula is an injury that occurs during prolonged labor. This condition harms women physically, socially, and economically. However, it is both treatable and preventable. Its persistence around the world is a reflection of continued poverty and poor access to reproductive health services faced by women, especially in the rural areas. We will be right back after this time with details. Stay with us.
Core TV News presents a platform with presence in over 30 states of the Federation. Be sure to be had. For live coverage of events, we have the capacity to deliver from anywhere in Nigeria and beyond. Contact us now on 0803-471-8550 or 0803-724-9733, 014-533-407.
Our 24-hour news station.
Welcome back. Each year, between 50,000 to 100,000 women worldwide develop obstetric fistula. Take a look at this video of a woman affected by this condition.
የእናቷ ልጅም እናቲቱም በዚያ ነው ያስቀመጥኳት። እኔ በስጭቶኝ ከሰው ጋር ማልቀመጥ ሰው ሲጠላኝ ጊዜ ዝም ብዬ እዚህ ላይ ልሙት ብዬ ሸፍኜ ነው ተቀመጥኩ እንጂ ቤት አይደለም። በጥግ በነሱ ጥጋቸው በታዛው ነው ዝም ብዬ ተቀመጥኩ በዙሪያ ነው። እንዲያ ስለሆነችብኝ ነው እንጂ ተማጠኔ ወጣች አይደለች ተኔ ምን ይሻለያታል። ነጦ እንደ አንድ ሳምንት ቆየብኝ በሆዴ ቀረ። ችግሩ እንደደረሰብኝ ያንን ጎትቶ አውስቶ ለሊት እኩል ተኝቼ ሳለ ኑሮማ ተባል ቤት ነበርኩኝ። በዚህ የተነሳ ሄጅልኝ አይሆንም እንዴት ተሆንሽ ሌላ ላግባ ብሎ ሌላ ገባ። መጫቴቱን ያውም የስድስት ወሪቱን ይዤ ወስጄ እዚህ መስጬ ተቀመጥኩኝ። እዚህ በጥግ እንዲሁኝ ተቀመጥኩ። አብሮ ማያስኖር ነገር ስለሆነብኝ እንዴት ዋላችሁ የሚል ሰው ስለማስገባበት ዝም ብዬ እንደየሆንኩ ነው ተቀምጬ። ሌላ ምን ተዳራለኝ? ስራ አልሰራ እና ላረግ ከሰው ዘንድ አልቀርም። እዚህ ላይ ነው ተሸሽጌ ተቀምጬ።
Welcome back. If you're just joining us, the program is Health Issues, and today we are talking about obstetric fistula. Women who experience this preventable condition suffer constant urinary incontinences, which often lead to social isolation, skin infection, kidney disorder, and even death if left unattended to. That is what we know, but let's find out what experts have to say concerning this disease.
When the woman is going into labor to deliver a baby, the head of the baby must engage through the pelvis, the birth canal, to come out. The process of labor is the ability of that head to come from the uterus and pass through that birth canal and be delivered. If that process is delayed or prolonged due to either what we describe in obstetrics or in anatomy as a disproportion between the head and the pelvis, either because the pelvis is too small, like what happens in some parts of the country where they marry at an early age, or the woman has overfed such that the baby is enlarged, is of big weight, the head of that baby can compress on the pelvis, and when there is inadequate obstetric care to recognize the fact that that head cannot pass through, it will crush the uterus or some of the birth canal against the pelvic bone, because they are all very thin and soft, and it will create a connection, a wound between those two structures, either between the uterus and the rectum, which is the passage for the feces, or the uterus and the bladder, which is the passage that contains urine.
Obstetric fistula is usually defined as a connection between a woman's womb and the bladder in front, or the rectum at the back in the pelvis. And this usually happens after a prolonged obstructed labor in most cases. And this connection makes the woman to leak urine, can even leak feces, depending on the connection. If it's connected to the bladder, the woman can leak urine through the vagina, and if it's connected to the rectum, if the vagina is connected to the rectum, she can leak feces, and he may be walking around with smells of urine and smells of feces.
This is it's like a sculpture of the uterus. This is the uterus. Now, usually you have the bladder in front here. The bladder is in front here. Now you have the inner lining of the uterus, and you have an outer lining here. These are epithelial surfaces. The coverings are what we call epithelium. Now, excuse me. For the bladder also, the bladder is in front here normally. If there's an abnormal connection, you see, the normal connection between the uterus and the outside is through the vagina. And that's how the baby comes out, through the vagina, or there's another connection to the abdomen, through the tubes. But usually, there is no connection between the bladder and the uterus. Then if there is now a channel between that uterus and the bladder stores the urine, then you find out that the urine may be coming out in an abnormal place.
occasionally, rape victims can have it because of the narrow, that will usually be the uterovaginal fistula. It will be between the vagina and the urethral passage, and that can occur. Also, infection can cause it at that point in time.
A fistula occur when a woman who, in most instances, have had bad antenatal care. Usually they don't have good antenatal care. No, they don't go to clinics. They're in the home. They want to be delivered by a community old age woman experienced in such deliveries. And when the woman goes into labor, instead of taking her to the hospital, they usually take her to these women's houses. And there, she'll be left alone, laboring. Sometimes they don't give them any pain relief. And if the labor is so prolonged, and at the point where the woman needs a cesarean section, and such facilities is not available, or the doctor is not there to do it, she ends up with a very prolonged labor that can cause necrosis of the vaginal wall against the rectum if the pressure is directed in that direction, or against the bladder if the pressure is directed in that setting. And in such instances, the tissue connecting the two will degenerate and will necrose, degenerate, and the woman will start leaking urine or leaking feces. Obstetric fistula can also be caused as a result of bad or septic abortion. It can also be caused by pelvic injuries. If a woman has pelvic fractures, can cause it. Or in women who have pelvic organ cancer like uterine cancer, vaginal cancer, bladder cancer, or rectal cancer, they can have connection between the vagina and the rectum or the bladder. Usually based on the history, if it's due to the fact that she's had a prolonged labor, and that is usually very obvious after about a few days, let's say about 5 days, she may start to leak urine through the vagina, and she will also start leaking, she may also start leaking feces through the vagina, and the smell will be so pervasive. The smell will be everywhere. She can't go outside because of the stigma. Everybody, wherever she goes, she'll be followed by the smell of urine, smell of feces, flies flying all over. So it's a very, very terrible social stigma. And in such instances, those women become a recluse, and they don't mingle with their friends outside or family members. They shun them.
there are interventions, there are treatments. But as we will say in medicine, prevention is better than cure. Because when this thing has already happened, it causes a lot of problem. Not only, problems of urine coming out through abnormal parts, stool coming out through the vagina, urine coming out through the vagina, and then you become a social outcast. But it's a lot of psychological problem, a lot of social problem. A woman who is passing stool and urine through the vagina, of course that's why the husband will reject her and send her home. And especially when this is a very young girl, uneducated, unempowered, uninitiated, you are thrown out from your husband's house. You are not accepted in your parents' house. You become a social outcast. Therefore, it's not only a medical problem; it's a social problem. It has a lot to do with their psyche, with their, acceptance in the society. They cannot go out. They are smelling. Urine is, continuously they're smelling of urine. And if stool is mixed with it, you can imagine the type of, terrible odor that is coming. And therefore, they are neglected. And therefore, prevention is better than cure. And how do we prevent that? We need to look at the issue of early marriage. We need to look at that a lot. Our children must go to school. I believe that when they are in school, and by the time they finish, at least secondary school, many of them may be bigger enough to marry. They'll be getting to 16 years, 15, 16, and by 18, of course, the pelvis may have developed enough to even carry the baby if they want to marry. But by the time you finish university, you can imagine, you get into 20, 21. That's once this will be reduced. Secondly, these type of things also occur in those who may be smaller in stature. Therefore, it's not only a medical problem, it's a problem of your nutrition. Therefore, in a place where you want to prevent this thing like this, it's not only education. In fact, let me say, education is the most important, most important reason, preventive measure for this type of thing, as I said, because by the time a girl is finishing secondary school and university, may be mature enough to marry, and that girl will know what to do when she's pregnant. She will likely go to hospital when she's pregnant. She will likely go to hospital when she's in labor, so that even if there is going to be a complication, there's going to be obstructed labor, somebody somewhere will know what to do and intervene before this problem. Therefore, education is number one. Two, as I said, looking at the area of early marriage. Number three, I want to say there should be a global, we should look at what is happening around us globally. Nutrition must be better. Our girls, our children must develop better. They must be able to eat. If you grow well and you are not very small, you are not likely to have this also. If the pelvis develop well, then you may find out that the issue of some of these complications may reduce. Therefore, we need to look at our agriculture. We need to look at nutrition. We need to look at childhood diseases. Therefore, so many areas we need to look at as a nation. Then we need to make sure that there are good clinics, antenatal clinic. That's girls, women, pregnant women, children, mothers are exposed to good medical care, at least very good antenatal care, so that you can take care of pregnant women, you can supervise them when they are in labor. This type of things will be prevented.
In Nigeria, it is not as rampant as before. So we could say about 10 to 15%. But this is coming down drastically. And we should, with legislation from government, education of the populace, the community about importance of going to school, importance of not allowing a child to marry very early, preventing forced marriage, contraceptive methods being available, education, sex education, such instances it can work well. Well, in the past years, it used to be very common, but because of education and the role of government in reducing the maternal mortality and child mortality, is now not so common, especially in cities. But in villages where there is poor attendance at antenatal clinics, there is usually no doctors there, they don't have well-trained nurses or midwives, it's still very common.
It's a campaign like this that can educate the people, that will let our people know that this type of problem exists around us. If there's nothing like this, then you find out that we continue in our ignorance, and problem will continue to be to accumulate and to increase. Therefore, a campaign like this is to sensitize the people, is to let the people know that this is something that is happening around you in your country, and therefore we should not fold our arms. I think it's so important.
Well, the campaign to end fistula it has been on for a long time and is gaining momentum now, most especially because of these incidents of child that are being put into marriage, young female girls that are being put in marriage less than 13 that should actually be in school. And the campaign is now gaining foothold, and it is done quite a lot to reduce the incidence of child marriage, poor obstetric practice, absence of attendance in antenatal care, and even some of the women, they don't even know they are pregnant until they are far advanced. Poor nutrition, sending young girls that are being thrown into marriage to go to school, and they can become something for themselves and become something for their family. Those and such methods can prevent obstetric fistula, and of course government has to come out with their own enabling environment, making it easy, make it compulsory for young girls, young boys to go to school, educating them when they are there about contraception, antenatal care, and the use of such methods to prevent unwanted pregnancy. Such needs to go, and then there needs to be enabling legislation by the government as well to back it up. Free primary education, making it compulsory for mothers to send their children to school. There are a number of NGOs now that are springing up and that are doing quite a number of good jobs in the prevention aspect, education, provision of medical care, antenatal facilities in communities where such facilities are absent.
Thank you for staying with us. Obstetric fistula can largely be avoided by delaying the age of first pregnancy, by the cessation of harmful traditional practices, and by timely access to quality obstetric care. Preventing and managing obstetric fistula will contribute to improved maternal health. This is how far we can go on today's edition of Health Issues. So join us next week, same time, same station for another talk on health. Have a wonderful weekend.
Core TV News presents a platform with presence in over 30 states of the Federation. Be sure to be had. For live coverage of events, we have the capacity to deliver from anywhere in Nigeria and beyond. Contact us now on 0803 471 8550 or 0803 724 9733 014 533 407.
A 24-hour news station.